Polio, short for poliomyelitis, is a highly contagious viral disease caused by the poliovirus. This virus can affect the nervous system, potentially leading to permanent paralysis or even death. Here's a comprehensive overview of the poliovirus. 1. The poliovirus type. Poliovirus is a member of the Picornaviridae family and belongs to the enterovirus genus. Structure. The virus is an RNA virus with a non-enveloped structure. Transmission. Poliovirus is primarily spread through the fecal-oral route, meaning it can be transmitted when an individual consumes contaminated food or water. It can also be spread through direct contact with infected individuals, particularly those with respiratory secretions. 2. Symptoms of polio asymptomatic cases. Many individuals infected with the poliovirus do not show symptoms, around 90 to 95% of cases. Non-paralytic polio. Some may experience flu-like symptoms such as fever, fatigue, sore throat, headache, nausea, and vomiting. Paralytic polio. In 1 to 2% of cases, the virus can invade the central nervous system, CNS, and cause paralysis. This can lead to muscle weakness, loss of reflexes, and in severe cases, permanent paralysis, often affecting the legs or respiratory muscles. Bulbar polio, a more severe form where the virus affects the brainstem, leading to difficulty breathing and swallowing. 3. Pathogenesis, how polio spreads in the body. The virus enters the body through the mouth, then multiplies in the throat and intestines. From there, it may enter the bloodstream and travel to the spinal cord, where it attacks motor neurons, leading to paralysis. 4. Types of poliovirus. There are 3 types of poliovirus, type 1, type 2, and type 3, with type 1 being the most common cause of paralysis. Type 2 was declared eradicated in 2015, and type 3 was declared eradicated in 2019. 5. Global eradication efforts. Polio vaccines. The most significant tool in the fight against polio is vaccination. There are 2 main types of vaccines used. Inactivated polio vaccine, IPV. Administered through injection, it contains inactivated, killed poliovirus. Oral polio vaccine, OPV. Administered orally, it contains live, attenuated, weakened virus. It is easier to administer but carries a very small risk of causing polio in rare cases, vaccine-derived poliovirus. Polio Eradication Initiative. Launched in 1988 by organizations like the World Health Organization, WHO, UNICEF, and the Centers for Disease Control and Prevention, CDC, the initiative has significantly reduced polio cases worldwide. As of now, polio is endemic in only a few countries, mainly Afghanistan and Pakistan, with many countries having been declared polio-free. 7. Diagnosis. Clinical diagnosis. Diagnosis is based on the patient's history and symptoms. If the individual has paralysis, polio should be suspected. Laboratory tests. The virus can be detected through stool samples or throat swabs. 8. Treatment. No cure. There is no cure for polio once the infection occurs. Supportive treatment. Treatments focus on managing symptoms. In cases of paralysis, physical therapy and the use of mobility aids may help improve function. In severe cases, respiratory support, e.g., ventilators, might be necessary. 9. Prevention. The polio vaccine is the most effective form of prevention, with the widespread use of both IPV and OPV leading to a dramatic decrease in polio cases worldwide. Good sanitation practices, including clean water and hygiene, are also important for preventing the spread of the virus. 10. Impact and current status. Global impact. Polio has historically caused widespread epidemics, leading to paralysis, disability, and death, especially before the vaccine was widely available. Eradication progress. Thanks to global vaccination efforts, polio cases have dropped by over 99% since the 1980s. While polio has been eradicated in most of the world, the fight continues in areas where the virus remains endemic, especially in conflict zones with limited access to vaccination. In summary, polio is a preventable viral disease with the potential for severe, lifelong consequences. Vaccination efforts have been instrumental in dramatically reducing polio worldwide, bringing the world closer to the goal of global eradication.